Concept mapping and critical thinking. Have you ever wondered how to make sense of complex information, especially in medicine? Concept mapping might just be the tool you need. Let's break down how it connects to critical thinking and why it is essential for effective study techniques in medicine. Concept mapping is a visual learning method that helps organize and representing knowledge. It connects related ideas in a structured way, using nodes for concepts and arrows for relationships. This visual representation allows you to see how different ideas fit together, creating a clearer picture of the material. Now, let's talk about critical thinking. This skill involves analyzing information logically and making reasoned decisions. It's not just about memorizing facts, it's about questioning assumptions and synthesizing information to solve problems. In medicine, where information is vast and complex, critical thinking is vital. So, how do concept mapping and critical thinking work together? When you create a concept map, you actively engage with the material. You identify key concepts and their connections, which requires analysis and organization. This process is at the heart of critical thinking. In medical education, concept mapping is particularly effective. Medical students need to integrate knowledge from various fields like anatomy, pharmacology, and patient care. By creating concept maps, they can visualize these relationships and understand how each piece of information applies to real-life scenarios. The benefits of using concept mapping for critical thinking are numerous. First, it encourages deeper learning. Instead of just memorizing facts, students grasp underlying principles and how they interact. This understanding is crucial for problem solving in medicine. Second, concept mapping helps organize and synthesize information from multiple sources. This skill is essential for making informed decisions in clinical settings. When students can see how different pieces of information relate, they are better equipped to tackle complex medical problems. Additionally, concept mapping enhances long-term retention. By structuring knowledge meaningfully, students can remember information more effectively. This is especially important in a field where details matter. Moreover, concept mapping supports collaborative learning. When students work together to create maps, they engage in discussions that build communication and teamwork skills. These are vital in the medical field, where collaboration is key. Finally, concept mapping serves as a self-assessment tool. It allows learners to identify gaps in their knowledge and adjust their study strategies accordingly. This proactive approach to learning can significantly improve overall performance. Research shows that medical students who use concept mapping improve their critical thinking skills compared to those who rely solely on traditional lecture methods. The active engagement and logical organization required by concept mapping lead to clearer thinking about complex medical issues. In summary, concept mapping is a powerful study technique that visually organizes information and encourages analytical thinking. It helps students develop critical thinking skills, which are essential for mastering complex subjects like medicine. If you are looking for an effective way to study, consider incorporating concept mapping into your routine. You might find it makes a world of difference in your learning journey.